Hi, welcome back to the Public Health Circle YouTube channel, where we learn all matters public health. Thank you for taking your time to watch this video. Now, in today's video, we'll learn about Kala Azar, a parasitic infection that has recently been declared as a pandemic in Wajir, Kenya. Kenya is found in the eastern side of Africa. Let's dive straight into it. Kala Azar is also known as visceral leishmaniasis. Leishmaniasis is caused by a protozoa parasite from over 20 Leishmania species. Over 90 sandfly species are known to transmit Leishmania parasites. There are three main forms of Leishmaniasis: visceral leishmaniasis, cutaneous leishmaniasis, and mucocutaneous leishmaniasis. Visceral leishmaniasis, VL, also known as Kala Azar, is fatal if left untreated in over 95% of cases. It is characterized by irregular bouts of fever, weight loss, enlargement of the spleen and liver, and anemia. Most cases occur in Brazil, East Africa, and India. An estimated 50,000 to 90,000 new cases of VL occur worldwide annually, with only 25 to 45% reported to WHO. It has outbreak and mortality potential. Cutaneous leishmaniasis, CL, is the most common form and causes skin lesions, mainly ulcers, on exposed parts of the body. These can leave lifelong scars and cause serious disability or stigma. About 95% of CL cases occur in the Americas, the Mediterranean basin, the Middle East, and Central Asia. It is estimated that 600,000 to 1 million new cases occur worldwide annually, but only around 200,000 are reported to WHO. Mucocutaneous leishmaniasis leads to partial or total destruction of mucous membranes of the nose, mouth, and throat. Over 90% of mucocutaneous leishmaniasis cases occur in Bolivia, the plurinational state of Brazil, Ethiopia, and Peru. What is Kala Azar? Kala Azar, also known as visceral leishmaniasis, VL, is a parasitic disease caused by the Leishmania parasites. Kala Azar is a serious, neglected tropical disease endemic in Wajir County, Kenya, transmitted by sandfly bites, and if left untreated, is fatal in over 95% of cases. Transmission. It is transmitted through the bites of infected female phlebotomine sandflies. Endemic regions. Kala Azar is endemic in Wajir County and other parts of Kenya, including the Rift Valley, eastern and northeastern regions. Severity. If left untreated, Kala Azar is fatal in over 95% of cases. Global impact. In 2022, Eastern Africa accounted for 73% of global VL cases, half of which occurred in children under 15 years. Major risk factors include socioeconomic conditions. Poverty increases the risk for leishmaniasis. Poor housing and domestic sanitary conditions may increase sandfly breeding and resting sites, as well as their access to humans. Sandflies are attracted to crowded housing because it is easier to bite people and feed on their blood. Human behavior, such as sleeping outside or on the ground, may increase risk. Malnutrition. Diets lacking protein, energy, iron, vitamin A, and zinc increase the risk that an infection will progress to a full-blown disease. Population mobility. Epidemics of leishmaniasis often occur when many people who are not immune move into areas where the transmission is high. Environmental and climate changes. The incidence of leishmaniasis can be affected by changes in urbanization, deforestation, or the human incursion into forested areas. Climate change is affecting the spread of leishmaniasis through changes in temperature and rainfall, which affect the size and geographic distribution of sandfly populations. Drought, famine, and flood also cause migration of people into areas where the transmission of the parasite is high. Symptoms of Kala Azar include prolonged fever, weight loss, fatigue, diarrhea and digestive tract problems, anemia, swollen lymph nodes, an enlarged spleen and liver, and darkening of the skin. Diagnosis and treatment of leishmaniasis involves several steps. For visceral leishmaniasis, diagnosis is made by combining clinical signs with parasitological or serological tests, such as rapid diagnostic tests. In cutaneous and mucocutaneous leishmaniasis, serological tests have limited value, and clinical manifestation with parasitological tests confirms the diagnosis. Treatment options for leishmaniasis depend on several factors, including the type of disease, concomitant pathologies, parasite species, and geographic location. Leishmaniasis is a treatable and curable disease, which requires an immunocompetent system because medicines will not get rid of the parasite from the body, thus the risk of relapse if immunosuppression occurs. All patients diagnosed with visceral leishmaniasis require prompt and complete treatment. Antiparasitic drugs are recommended for treatment. Preventing and controlling the spread of leishmaniasis is complex and requires many tools. Key strategies include early diagnosis and effective prompt treatment, which reduce the prevalence of the disease and prevent disabilities and death. It helps to reduce transmission and to monitor the spread and burden of the disease. There are highly effective and safe anti-leishmanial medicines, particularly for visceral leishmaniasis, although they can be difficult to use. Access to medicines has significantly improved thanks to a HO-negotiated price scheme and a medicine donation program through HO. Vector control helps to reduce or interrupt transmission of the disease by decreasing the number of sandflies. Control methods include insecticide spray, use of insecticide-treated nets, environmental management, and personal protection. Effective disease surveillance is important to promptly monitor and act during epidemics and situations with high case fatality rates under treatment. Control of animal reservoir hosts is complex and should be tailored to the local situation. Social mobilization and strengthening partnerships are crucial. Mobilization and education of the community with effective behavioral change interventions must always be locally adapted. Partnership and collaboration with various stakeholders and other vector-borne disease control programs are critical. That brings us to the end of the video, and I believe you learned something from it. Thank you for watching. Please like this video and share it with your friends and colleagues. Don't forget to subscribe to this channel for similar informational videos. Bye!